India health authorities are warning about a fungal infection seen in some COVID-19 patients, which can disfigure facial features and even kill. Health officials say patients who have been on medication for some time or who had prolonged stays in the ICU are particularly susceptible. India is still in the midst of the world's fastest growing coronavirus outbreak.
This type of fungal infection, which is nowadays being talked about or also called black fungus, is actually rhinocerebral mucormycosis. And this is a deadly infection that involves the entering of the fungus into the nose through the airborne route, and it causes destruction and death of local nose tissue. And once it starts rapidly expanding, it can go into the eye, damage the eye, and then go further up into the brain and cause death in the person, all in a very short period of time. And but the only thing is that this is a disease of the immune system, so only people with weak immune systems get affected by this disease. The fungus is very serious. The fungus is serious because of its rapid fulminant pattern. In a person, in the environment, the fungus is nothing but a plant fungus seen throughout the air, and even in normal air culture. If you take out an air sample, you will be able to culture this fungus. But if it enters the immunocompromised host, whose immunity is lowered, it can be a very deadly fungus. It is linked to COVID recovered patients nowadays. They are a big subset because COVID related people, sometimes having moderate to severe symptoms, are treated in the post recovery period and during the recovery with corticosteroids, that is oral and IV steroids. And because of that usage and also the course of the weakening of disease process itself, the disease may weaken the immune system and allow this fungus to enter the body. It is not possible sometimes to prevent this fungus from hitting you because it is there in all environment around us. But if you have had if you have had COVID infection in the recent past and you were treated with steroids, we will assume that your immune system is low. On top of that, if you had diabetes, you are a renal transplant patient, you are a cardiac patient, you have been on cancer chemotherapy, or you are very old, then automatically you come in the high risk group for acquiring this infection. So if you want to prevent it, you must carry on the same precautions as you were doing when you were not having COVID. We have seen over now 25 cases in the last 22-23 days, and this is definitely an alarming number. Very challenging to treat people who get this infection because number one, it is difficult to detect mostly. Right now, the symptoms of this disease are overlapping with normal sinus infection and sometimes an eye infection and sometimes headache, which neurologists are treating as migraine. But actually sometimes this fungus can be entering inside, and in the course of 3 to 5 days, if not treated, can lead to death of the person. The world community is waking up to this infection. Definitely I can talk at the national level. We are in the second wave of the post-COVID effects, and we know that the treatment of COVID requires these steroids. So patients are being more and more aggressively being treated with steroids. We are saving more lives than we were saving in the first phase of COVID infections. So therefore, the steroids are a gold standard. However, in this second phase, we are also seeing some breakdown of treatments and also leading to these kind of opportunistic infections. The case reports are far and few in number, but they are there from America, they are from Italy and Europe, and also from China.
Sinonasal, orbital, and rhinocerebral. These are 3 types of mucormycosis or black fungus. Their cases are currently on the rise in India. All three types are equally dangerous. But what exactly is this infection? The Center for Disease Control and Prevention defines black fungus as a serious but rare fungal infection caused by a group of molds which live freely in the environment, particularly in soil, wet surfaces, and decaying organic matter. People get infected when they come in contact with these fungal molds. For example, the lung or sinus forms of black fungus occur after someone breathes in the spores. In pre-COVID times, this infection was quite rare around the world, but since the pandemic, cases have increased due to complications related to the virus. In India, only a few cases were reported in New Delhi last year, but now the new virus mutant is driving a surge in black fungus infections across the country. Cases are being reported at hospitals in New Delhi, Uttar Pradesh, Madhya Pradesh, Bihar, Gujarat, Maharashtra, Telangana, Karnataka, and Tamil Nadu. Who is getting infected or is likely to be infected? According to the Indian Council of Medical Research, 4 kinds of people. Those who used steroids during their COVID-19 treatment, thus lowering their immunity. Those who had prolonged stays at hospital ICUs and are yet to recover. Those with diabetes or a history of kidney and heart failure. And those who are on medication for major health that reduces their ability to fight pathogens. The infection typically starts growing from the nose, upper jaw, and travels to the brain. Experts say once it reaches the brain, it's almost a death sentence. So if you are experiencing any of these symptoms, see a doctor at the earliest. Pain under the eyes, one-sided facial swelling, nasal or sinus congestion, black lesions on nasal bridge, stuffy or bleeding nose, toothache or loosening teeth, and partial loss of vision. Wear a mask at all times. Wear shoes, long trousers, and preferably gloves if you step out into a park or for gardening, and maintain personal hygiene, including a thorough scrub bath. What about treatment? How can black fungus be cured? That's the big challenge. Treatment involves surgically removing all dead and infected tissues and administering a course of antifungal therapy, but the drugs used for this therapy are expensive and in short supply. The basic cost of even an antifungal injection is around 9,000 rupees per day. At a time when India's health infrastructure is already facing a shortage of supplies, the news of black fungus has come as an additional headache for doctors.
It's time to get that daily news. I ain't watching TV, I'ma log on to YouTube. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Talking about that raw, uncut news. You a fool, you believe that mainstream and local news. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. And 411, keep the 411. On a sensitive subject, keep it 100, don't bite no tongue. If you cannot take the truth, then this is finna hurt. Who's to say if it's a round or a flat earth? Stick to the facts, what's some feelings? I don't do no capping. Read that paper, seen that news, now you know what happened. Playing a pretty picnic, but they control that weather. Same crisis actors, like we don't know no better. Thing about the truth always come to the light. Problem is too many, all bark, no bite. Like muscle, no might. I don't know what happened to them, but I know the way they said somebody ain't right. It's time to get that daily news. I ain't watching TV, I'ma log on to YouTube. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Talking about that raw, uncut news. You a fool. You believe in mainstream and local news. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe.
In hospitals around the country, a growing concern: a fungus that has already infected at least 587 people in the U.S., more than 300 in New York State, including some at Brooklyn's Mount Sinai.
When did you first see it at this hospital?
We saw a cluster of patients develop in 2016. And that's really when the outbreak began, particularly in New York and Brooklyn region.
The fungus is a form of the very common Candida, which is easily treated. But this strand, called Candida auris, is stubborn. 90% of cases are resistant to at least one antifungal medication. 30% are resistant to 2 or more.
The aha moment we had was when a patient died with it, and we did cultures all over the room. We found that the Candida auris was everywhere.
When you say everywhere, what do you mean?
We found it from top to bottom, from the ceiling to the wall monitors, to the artificial respirators, to the pumps, to the bed, to the floors.
The patient who contracted the fungus died after 90 days.
This doesn't affect healthy people at home. It preys on those that are immunocompromised with chronic health conditions.
There is growing worry tonight about a new strain of superbug spreading through hospitals in New York and across the country. It's deathly dangerous and tough to fight, but trying to avoid becoming infected is proving just as difficult. About superbug secrecy, Jim?
It's not a threat to the general public, but to hospital patients and residents in nursing homes.
Candida auris can be lethal.
New York City is ground zero for the fungus, but health officials are keeping the public in the dark
about which facilities are battling this superbug. In hospitals and nursing homes throughout New York City and its suburbs, a deadly drug-resistant fungus is spreading, threatening the lives of those with weakened immune systems.
It's a very serious health threat because it's a superbug, meaning resistant to all known antibiotics.
And that makes the superbug known as Candida auris lethal for those patients with existing medical problems. But hospitals, the Center for Disease Control, and New York City and state health departments have so far refused to give 7 on Your Side investigates the names of the facilities where Candida auris has caused serious illness and deaths.
If they're rattled to the point where we have, secrecy pacts among hospitals and public health agencies, you're just hiding something that obviously needs more attention and more resources to try to deal with.
The numbers underscore the growing health threat. Since first surfacing in 2016, Candida auris has stricken 613 people nationwide. More than half of those cases, 319, have occurred in hospitals and nursing homes in New York, mostly in and around the city. And here's what worries health officials. 179 New York patients died. That's a 56% mortality rate.
Where are these infections occurring? These are serious, potentially life-threatening infections that in some cases are difficult, if not impossible, to treat.
The director of Public Citizens Health Research Group says it is unethical to leave the public in the dark.
They're more interested in protecting the hospitals, the institutions affected, than protecting the interests of the patients.
And by protecting the hospital, what do you mean specifically?
They may fear that it would harm their reputation, maybe harm their financial bottom line.
The New York State Department of Health told us they have been, quote, working aggressively with impacted hospitals and nursing homes to implement infection control strategies for Candida auris.
It's called black fungus or mucormycosis. It's a rare and deadly fungal infection. It is being reported in several states in India, mostly in post-COVID patients, people who have survived the virus but now face a new battle. Doctors say there is nothing to panic about. What exactly is this infection? What's causing it? How many cases are being reported? Where are they being reported? And most importantly, is black fungus life-threatening?